Hi guys, Rachael Cook, Doctor of Audiology at Applied Hearing Solutions in Phoenix, Arizona. And in today's video, I'll be telling you if acupuncture could be the cure for tinnitus. Coming up. Upwards of 15% of the United States population suffers from tinnitus, a phantom ringing, buzzing, or humming sound that is not actually present in your environment. Technically, tinnitus is not a condition itself, but rather a symptom of various other medical conditions. Now, the primary cause of tinnitus is untreated hearing loss that is found in nearly 90% of tinnitus sufferers. This happens for two main reasons: cochlear damage and auditory deprivation. Damage to the cochlea, our hearing organ, occurs primarily from loud noise exposure, aging, and health conditions that impact blood flow, like heart disease. This damage does not allow the cochlea to send certain sounds up to the brain within the damaged area, resulting in auditory deprivation. Auditory deprivation can also be caused by a physical blockage of sound, such as an ear canal that's plugged with earwax, or the middle ear space being filled with fluid. Tinnitus can even be caused by a benign tumor on the auditory nerve called an acoustic neuroma. If you only have tinnitus in one ear, or if the tinnitus that you have is much stronger in one ear than it is in the other, you may require medical intervention, so be sure to schedule an appointment with an audiologist right away. But for some tinnitus sufferers, the ringing in their head has nothing to do with their ears, stemming from head and neck injuries, TMJ disorder, and even blood pressure issues. The cause and presentation of each person's tinnitus is unique to the individual, making it incredibly difficult for researchers to find a cure. For that reason, there is still no medication on the market that is proven to reduce or eliminate the perception of tinnitus. While hearing aids are successful at reducing or eliminating the perception of tinnitus by returning missing sound back to the brain, it only works in about 60 to 70% of individuals. But as is seen in so many other medical circumstances, when Western medicine is stumped, Eastern medicine is always ready to offer alternative recommendations. Eastern medicine, and traditional Chinese medicine in particular, offer more natural and holistic alternatives to addressing common ailments. And tinnitus is no different. One such tinnitus management method recommended by Eastern medicine practitioners is acupuncture. But can it really work to reduce tinnitus? But before I answer that, if you could take just a quick second to give this video a thumbs up, it brings videos like these to a wider audience. And of course, if you have not yet already, make sure to hit that subscribe button with notification bell so that you never miss any one of our newly released videos. Now, let's start by answering the question, what is acupuncture? Acupuncture is a traditional Chinese medicine practice that involves inserting thin needles into the skin and muscle on various parts of the body. These needles are used in very specific locations to open blocked channels in the body that could be disrupting your body's vital energy called qi. While often administered alongside traditional therapies, acupuncture is used across a wide range of health conditions, including pain management, stress reduction, and even infertility. Researchers are still determining the exact mechanisms of acupuncture, but they do believe that it has something to do with the release of endorphins that can help to reduce pain naturally. Additionally, it is believed that needle placement can trigger an increase in circulation, which can help to speed up the healing process. Regardless of the mechanism, reported effects of acupuncture include reduced pain, lower stress, and improved mood. Now, all those benefits sound great, but can acupuncture really reduce tinnitus? Let's see what the research has to say. Now, a 2015 study out of Brazil took 76 people with tinnitus and split them into two groups, a control group and a study group. Both groups were given needling on the scalp, but in different locations. The study group's needles were placed in an area specific to treating ear-related issues as outlined in traditional Chinese medicine. The control group received scalp needling about 3 centimeters above that area that did not correspond to any acupuncture points outlined in traditional Chinese medicine for really any concerns. Interestingly enough, both groups saw statistically significant reductions in their tinnitus perception, albeit a bit stronger in the study group. However, this study only looked at one treatment session, and traditional acupuncture is generally facilitated over several sessions. That led me to a 2018 study out of Iran with 88 subjects split into a study group and a placebo group. Instead of placing needles into both groups of test subjects, real acupuncture was administered to the study group, while the placebo group was fitted with fake, pain-free needles similar to a sticker. Again, the results of the study showed that both groups saw statistically significant reductions in their tinnitus, although these results were stronger in the study group again. But how crazy is it that even the group that only had stickers placed still saw a significant reduction in tinnitus? But we'll touch more on why I think that is in just a minute. Sorting through nearly a dozen systematic reviews of randomized controlled trials completed over the last 15 years revealed mixed results. Some found significant reductions in tinnitus, some found no differences in tinnitus, and a very small amount of studies suggested a possible increase in tinnitus. Anecdotally, I will add that research outcomes also seemed to be influenced by location. Test subjects from countries that already follow traditional Chinese medicine practices seemed to have a more significant reduction in tinnitus from acupuncture than test subjects from countries where Eastern medicine is viewed more as an alternative treatment. Regardless, what does this mean as a management method for tinnitus sufferers overall? Ultimately, research is, yet again, unable to draw definitive conclusions about the effectiveness of acupuncture for managing tinnitus. However, other than the requirement of placing tiny needles across the body, the process of receiving acupuncture is generally pretty relaxing. Scheduled acupuncture sessions can serve as a recurring time and place to close your eyes, relax, and even meditate. With the pace of life these days, it can be difficult to fit in these little pockets of peace. Without ways to relax and unwind, stress levels increase, thereby increasing tinnitus for many people. This relaxation practice alone can help to reduce stress and anxiety and elevate mood, as evidenced in the placebo group that saw significant reductions in their tinnitus, even without true acupuncture needles being placed. Now, if you try acupuncture for your tinnitus and it doesn't work, then you may want to try one of the other treatment methods that has been proven by research to be effective for managing tinnitus. In addition to treating tinnitus with hearing aids, if your tinnitus is caused by hearing loss, there are also other tinnitus management options, such as tinnitus retraining therapy, progressive tinnitus management, and cognitive behavioral therapy. New and unique treatment therapies are being implemented as we speak, such as bimodal neuromodulation systems like Linear. This system uses sound therapy combined with tongue stimulation to reduce the perception and annoyance of tinnitus. Be sure to check the description below for links to videos from myself and Dr. Cliff Olson for a deeper dive on these tinnitus management options. If you have tinnitus of any kind, but especially tinnitus that is louder in one ear than the other, develops suddenly, or is experienced alongside hearing loss or vertigo, your first step should be a comprehensive hearing evaluation by an audiologist who specializes in tinnitus testing and treatment. If you're on a journey to manage your own tinnitus and it seems as though you've tried everything, acupuncture probably can't hurt to try. As with any medical treatment, be sure to consult with your primary care provider to ensure that acupuncture is safe to try according to your own body's considerations. And if you've tried acupuncture for tinnitus management, don't forget to tell me if it worked or if it didn't in the comments below.